It's been a remarkably rewarding year in what's been a remarkably challenging year at the same time. Certainly, our biggest challenges, and I think most nonprofit organizations are facing this reality that we can't hold fundraising events. We can't go meet new donors. There's basically, at this point, an opportunity for us to either communicate with the existing donors we have via email, phone call, what have you, um, and not a lot more. It's very, very difficult. We all as nonprofits rely on what we call entry points. Some place where a new individual can discover the work you're doing and develop a passion for it and want to support it. That has not existed, and that's been a really significant challenge in terms of creating new fundraising and continuing to fund the work we're doing. As far as what has been really rewarding, we have had the opportunity, because of the groundwork we laid in previous years, to work on passing the comprehensive non-discrimination ordinance with Proud Savannah and Mayor Van Johnson. We had the opportunity to bring on a new executive director for the center who's been doing tremendous work. Since we had to close for a little while, we took the opportunity to reconfigure spaces, paint spaces, install new art installations, and have done a lot to make the center a more functional and welcoming space for our community. And as we've now reopened, we have taken the opportunity also, while we weren't able to be doing some of the direct client services, to build new partnerships. So probably the most exciting thing that I have been able to witness over the last few months has just been the partnership we've developed with Georgia Southern. We have partnerships with, I believe, 6 departments now at Georgia Southern, helping us to provide mental health services through their doctoral program, art programming, gender studies programming, all sorts of partnerships with students and alumni and faculty that are really allowing us to do things that we could never do alone. The ability for us to partner on grant applications, the ability for us to put to use the expertise that those in higher education have in some of these fields into practical service for the community. And that's been really, really exciting. And I'm sure we could have gotten there without the pandemic, but the fact that we were unable to focus on some other things gave us bandwidth to apply to new opportunities, and that's been a real blessing for us. There is currently one physician in the county, I believe, and it includes neighboring counties actually, that is specializing in treatment for transgender individuals. The access for mental health care that specializes in treatment of LGBT individuals and the challenges related to the issues that we face, whether that be rejection from families, whether that be transitioning, gender coming out, all of these are specific needs, and the availability of those programs simply doesn't exist to a large extent in the free market in the community. Same thing with youth programming, that we do still very much face the reality that a lot of kids go to private religious schools and they're looking to the community around them, their network, their resources, their families, and they're not seeing themselves, and they're not seeing someone that they can be open with and where they can find help, and they have questions and they're facing depression and they are needing an outlet where they are going to know they're going to be okay. And the center provides all of that. It's also just a wonderful gathering space. We have many in the community. We're about to celebrate, or commemorate rather, World AIDS Day, and that'll be December 1st. And, at the height of the AIDS crisis in the early 90s, over 5 years, we lost 500,000 gay men in this country to that virus. That virus has continued to ravage members of our community. It's had a particularly heavy impact on the trans community in recent decades. And the reality for us is that there's a lot of folks who are of that generation who have lost partners, who are struggling to find new connections, who are sometimes isolated and alone, and the need for a community center where you can just be who you are and be around other people who share your similar experiences um, is life-saving. Truly, it is a lifeline to a lot of people who otherwise don't have someplace else to